Professor Fatimah Lateef.
Mr. Speaker, Mr. Deputy Speaker, I stand in support of this bill. The TCM industry has boomed of late. This could be due to the increased demand for alternative therapies and enhanced awareness for such therapies, and also the fact that there is now more interest and research into this area. When we speak of TCM, it can conjure different images in different persons, ranging from the neighborhood sincere shop with herbal smells to the very established companies such as Yu Sang International Limited. During a recent survey by MOH, it was noted that there are about 10,000 Singaporeans who visit and seek TCM treatment every day. Not a small number at all. There will always be a certain code of conduct, etiquette and practice guidelines which will be ascribed to every body of professionals. The same must apply to our TCM practitioners who are also involved in caring for the public and patients, and thus must be assessed with accountability as well. A few points to bring up. Firstly, the bill first enacted in the year 2000 with a view to raising standards and the conduct of practice in the TCM sector is now being reviewed. Since then, have there been any cases which require disciplinary action or suspension? If so, what are the common reasons and root causes? And I ask about this with the intent to see if we can address some of these in this latest bill that we are discussing today. Secondly, I support the formation of the inquiry committee where the need arises versus having a permanent one in place for a certain term, because it is more relevant to appoint according to the types of cases, breaches or issues that we are handling at a certain point in time. This way we can appoint the appropriate type of TCM personnel or even specialists to provide opinion and consultation or serve as an expert witness. Thirdly, pertaining to the compulsory continuing professional education, I firmly support this. I also have a few suggestions to make. One, to have the setup of a directory electronically for courses and training being offered for easy access and knowledge of all TCM practitioners. The usual organizers can come together to discuss and brainstorm this and see how best to execute. But for those who want to offer ad hoc courses and training, there should be a body of persons looking into the suitability of these courses to ensure certain standards are met. There must be a secretariat to also monitor and carry out surveillance to track the number of points and warn practitioners of the shortfall if they risk not getting renewal of their practicing certificate. There were also some concerns on the cost to be borne by the practitioners themselves for these courses. In the medical and nursing profession, for example, established institutions have got a sponsorship scheme and other forms of support for their practitioners. Now, for large TCM groups, this may be feasible to offer, but for the lone TCM practitioner, there may need to be some other considerations given or offer of subsidies or perhaps even a credit scheme. This will be for the ministry to review and consider. Of course, some courses can be offered online, though of course e-learning will also take time and money to set up. Of course, some offset can take place by offering some of these courses through SkillsFuture or other upgrading grants, but that is something to be reviewed with caution, I suppose. In this context, can the ministry also update us on the use of the TCM development grant? What can this grant be utilized for? Is it just for education or improvement of practice and setup? I note also the number of points for CPE required over 2 years. Can I ask if there will be some flexibility given to the TCM practitioners, especially for the first 2 years, as a running-in period? This request is with consideration that some of our TCM practitioners are in the older generation and they're in solo practice, and they may need time to adjust to this to get used to the new guidelines as well. Next, can I also get some clarification on the term TCM practitioner as used in this bill? Are the people who run the sincere shops prescribing herbal type medications in this category as well? How about those who offer massage and tuina services as practitioners, as well as the dispensers in our neighborhood shops? Are they also incorporated into this bill under consideration? On the 11 members of the board, can I suggest also that they represent TCM practitioners who are generalists and also some who are specialists in certain aspects of the practice. But I also note that we may not have the relevant and adequate numbers of specialists in the TCM area for now, so therefore this is something perhaps to be considered later on. With TCM services, the fees we note can range from as low as $1 to $2 in the neighborhood and community clinics to the highly priced ones in advanced centers. What's the ministry view on this, and will we be moving more towards some kind of range standardization, perhaps even into different categories of services which are being offered? And finally, on the issue of medical certificates by TCM practitioners, and recognition by employers, this is a long-drawn and issue that has been debated very often. Are we planning to come up with some standardization or guidelines? This has always been a controversial issue, and I think it will continue to be because of the range of services as well as TCM practitioners that are out there. So perhaps some comment from the ministry on this. All in all, I support the bill. Thank you.